If you are a man and you are already over 40, you need to pay very close attention to what I am going to show you right now, because this can completely change the way you take care of your health from here on out. There is a silent process happening inside your body at this very moment, a process that, little by little, may be enlarging your prostate without you even noticing. And the most alarming part is that most men only find out when the symptoms start appearing in an uncomfortable and even desperate way. You start waking up once a night to urinate, then twice, then 3 times. Suddenly, you notice that the stream is not the same anymore, that there's difficulty starting to urinate, or that constant feeling that the bladder never empties completely. And this gradually affects your quality of life, your sleep, your energy, your well-being. But here is the most important point that almost nobody explains to you clearly. This does not happen only because of age. There is a biological mechanism inside your body that accelerates this prostate growth over the years. And if you do not understand this mechanism, you only react to the symptoms instead of acting on the root cause. And that is exactly what causes millions of men to enter a dangerous cycle. They ignore the signs at first, then they start depending on medications. And by the time they realize it, their quality of life is already compromised. The good news is that today you are going to understand exactly what is behind this problem, and, more importantly, how to use something simple, accessible, and natural to help your body fight this process. I am going to show you how a common food can act in a way similar to medications used in medical practice, helping to reduce prostate growth, relieve urinary symptoms, and even protect against more serious complications in the future. And, most importantly, this is not based on opinion or guesswork. There are scientific studies analyzing the role of natural compounds in prostate health, especially antioxidants like lycopene, which demonstrate relevant effects in reducing oxidative stress and cellular protection. Before anything else, let us understand what is happening inside your body. The prostate is a small gland, approximately the size of a walnut, located just below the bladder. It surrounds the urethra, which is the channel responsible for conducting urine out of the body. As the years go by, this gland tends to increase in size. This process is known as benign prostatic hyperplasia, or simply an enlarged prostate. And as the prostate grows, it begins to press on the urethra. It is exactly this pressure that generates the symptoms so many men report. The main signs include the frequent need to urinate throughout the day, waking up several times during the night, the sensation of incomplete bladder emptying, urinary urgency, a weak stream, dribbling after urinating, and difficulty both starting and stopping urine flow. But what many men do not realize is that these symptoms begin in a mild and progressive way. At first, they seem like just a small nuisance, something you ignore, but over time they evolve. Sleep begins to be constantly interrupted, daytime energy decreases, quality of life drops, and in many cases more serious complications arise, such as recurrent urinary tract infections or urinary retention. If you have already noticed any of these signs, even in a mild form, this is already a warning from your body. And here is an important fact. This is extremely common. Benign prostatic hyperplasia is one of the most common urinary diseases in older men, affecting 14 million Brazilians, according to the Brazilian Society of Urology. As men age, the prostate naturally tends to enlarge due to cumulative hormonal stimulation over the course of a lifetime. By the age of 80, 90% of men suffer from prostate enlargement. Now let us talk about how this is treated in medicine. In general, there are 2 main types of medications used. The first group is alpha blockers, which work by relaxing the muscles around the prostate and the bladder, making it easier for urine to pass through. The second group is 5-alpha reductase inhibitors, which act directly on the hormonal mechanism responsible for prostate growth. And here is the key point you need to understand. Inside your body there is an enzyme called 5-alpha reductase. This enzyme converts testosterone into a much more active substance called dihydrotestosterone, or DHT, And it is precisely DHT that stimulates the growth of prostate cells over time. In other words, the problem is not just age, it is a continuous hormonal process. And that is exactly why medical treatments focus on blocking this mechanism. Now comes the part that very few people know. There is a natural compound that also acts on this process. Its name is lycopene. Lycopene is a carotenoid, a type of extremely potent antioxidant, found mainly in red foods. And the most interesting thing is that it has a special affinity with prostatic tissue. After being consumed, lycopene is incorporated into lipid micelles from the diet and is absorbed by passive diffusion in the intestinal mucosa, where it is incorporated into chylomicrons and then released to be transported by low and very low-density lipoproteins through the lymphatic system to the liver and other organs, such as the adrenal glands, the prostate, and the testes. Its action goes far beyond that of a simple antioxidant. It helps neutralize free radicals, reduces oxidative stress, decreases inflammatory processes, and can interfere with mechanisms involved in cell growth. In preclinical trials, lycopene relieved chronic prostatitis and chronic pelvic pain syndrome in an animal model, presumably due to its anti-inflammatory properties, causing a downregulation of inflammatory cytokines. And it is exactly this combination of effects that draws the attention of science. Lycopene acts by inhibiting the activation of carcinogenesis, proliferation, angiogenesis, invasion, and metastases, in addition to blocking the progression of the tumor cell cycle and inducing apoptosis through changes in various signaling pathways. In simpler terms, lycopene interferes with processes that cause cells to grow in an uncontrolled way. And this is highly relevant when we talk about a gland that, in men, has this natural tendency to grow as the years pass. Several observational studies show that men with higher levels of lycopene in their blood tend to have a lower risk of prostate problems. According to studies conducted at Harvard University, the intake of red fruits and vegetables appears to reduce the risk of prostate cancer by 35%. In addition, diets rich in tomatoes and derived products have been associated with protective effects over time. But it is important to make something clear here, especially to maintain the credibility of your content. Despite the promising results, not all clinical studies show consistent effects across all parameters, such as PSA levels, and more research is still needed for definitive conclusions. In other words, lycopene should not be seen as a miraculous cure, but rather as a powerful ally within a health context. And that, in fact, increases the authority of your content. Now, back to the practical side. Where do you find lycopene? Mainly in red-colored foods. Among them are watermelon, guava, papaya, pink grapefruit, raspberries, strawberries, and tomatoes. In addition to the tomato itself, derived products such as puree, juice, and sauce are even richer in lycopene, since the absorption of this phytocompound improves with processing. The tomato is the most concentrated and most studied source of this nutrient, and here comes a detail that completely changes the game. The lycopene present in raw tomatoes is not as well absorbed by the body. While the lycopene from raw tomatoes has a bioavailability of around 13%, the lycopene found in cooked tomatoes is 70% bioavailable. Extra virgin olive oil pairs well with tomatoes, since a little fat also increases the absorption of lycopene. Do you understand the importance of this? When the tomato is heated, a breakdown of the cellular structures occurs, releasing lycopene and making it much more bioavailable. In raw tomatoes, lycopene is in a linear form, but after heating, it takes on a circular conformation, the same one found in the bloodstream. That is why tomato sauces are considered one of the best forms of consumption. It is also worth noting that the heat used in cooking needs to be moderate. Some studies indicate that cooking tomatoes at temperatures above 100 degrees Celsius would already impair the antioxidant activity of lycopene. A tip is to place tomato slices on top of food that is already cooked in the pan and cover it for about 10 minutes, during the final cooking time of the preparation. Another important point to know, the absorption of lycopene can be affected by other elements of your diet. In addition to olive oil, which enhances absorption, certain fibers in excess can reduce lycopene absorption. Some carotenoids, such as lutein and beta-carotene, can also compete during intestinal absorption. This reinforces the idea that the context of the diet as a whole matters, not just one isolated ingredient. Now, let us talk about quantity. To take advantage of the benefits of tomatoes, it is recommended to consume about 3 to 4 tomatoes per day. Adding a little olive oil during cooking can increase the bioavailability of lycopene, improving its absorption. And the most interesting thing is that you do not need anything extreme. Small daily amounts can already make a difference over time. But lycopene does not work alone. It is even more powerful when it is part of a broader dietary strategy focused on male health. And here comes a point that deserves special attention. 2 other fundamental nutrients for prostate health are zinc and selenium. Zinc plays a fundamental role in the functioning of the prostate and in metabolism. It participates in the regulation of apoptosis in prostate cells and in the Krebs cycle. Low zinc levels can be directly linked to benign prostate enlargement and cancer. Zinc inhibits the growth of prostate cells and tissue and controls the action of testosterone, a hormone that is at the origin of several prostate pathologies. Good sources of zinc include peanuts, beans, almonds, dark chocolate, chickpeas, pumpkin seeds, and lean meats. These are foods that are easy to include in daily life and that make a significant difference in long-term prostate health. Selenium is another important mineral with antioxidant properties that may play a protective role against cancer, including prostate cancer. The Estados Unidos nut, consumed in small daily amounts, is one of the richest sources of selenium available in Estados Unidos. Cruciferous vegetables, such as cauliflower, broccoli, bok choy, and cabbage, contain a natural chemical called sulforaphane, which research has shown to minimize the prospect of prostate problems, such as benign prostatic hyperplasia and even cancer. In other words, the diet that protects your prostate is varied, colorful, and accessible. It does not require imported products or expensive supplements. It requires consistency and knowledge. In addition to diet, your complete lifestyle also enters the equation. The consumption of alcohol and tobacco can increase the risk of prostate problems, since substances such as acetaldehyde, produced by alcohol metabolism, can damage the body's DNA and proteins. Regular physical activity improves overall health, reducing the risk of changes that can trigger cellular abnormalities. Stress can worsen benign prostatic hyperplasia. Through the fight-or-flight response, it releases large amounts of the hormone adrenaline, which causes the muscles of the bladder and prostate to contract and the muscles of the pelvic floor to tighten. In other words, managing stress is not a luxury. It is part of the male health protocol. And there is one more point that few men take seriously: hydration. Many men with early urinary symptoms drink less water out of fear of worsening their trips to the bathroom. But this reasoning is a mistake. Adequate hydration keeps the urinary tract functioning well, reduces the risk of infections, and helps eliminate toxins that could aggravate inflammatory processes in the prostate. The recommendation is to drink water regularly throughout the day, but reduce intake in the hours before going to sleep, which already helps significantly to decrease nighttime trips to the bathroom. And here comes an important strategic point. The problem is not just in what you consume, but in consistency. There is no point consuming it once and expecting results. The effects happen with regular consumption over time. A tomato sauce today, a Brazil nut tomorrow, broccoli at lunch, olive oil in the seasoning, exercise 3 times a week, stress under control, regular checkups. It is this combination of simple habits, maintained consistently, that transforms a man's health trajectory. Now think about this. If something as simple as adjusting your diet can directly influence a process that affects millions of men, Why wait for the symptoms to get worse before taking action? Why leave it to take care of this only when it has already advanced? The truth is that most men only look for a solution when the problem is already established. But you do not need to follow that path. You can act before. You can reduce risks. You can improve your quality of life with simple decisions. And it all starts with information. Early diagnosis is essential to increase the chances of recovery. Performing preventive exams annually from the age of 40 and maintaining regular medical follow-up are fundamental for early diagnosis and less invasive treatments, minimizing side effects. This means that the content of this video does not replace a medical consultation. It enhances what you can already do in your daily life while keeping professional follow-up up to date. Now, you understand that prostate health does not depend only on medications. It is also directly linked to your lifestyle, your diet, and the choices you make every day. And that puts you in control. Lycopene from tomato sauce, zinc from seeds and legumes, selenium from Brazil nuts, sulforaphane from broccoli, omega-3 from salmon and sardines, regular exercise, hydration, quality sleep, controlled stress, regular checkups. These are not secrets from any health guru. They are practices backed by science and accessible to any man who decides to make his own health a priority. If you apply what you learned here, you will already be one step ahead of most men. And in the end, taking care of your health is not about miraculous solutions. It is about consistency, knowledge, and action. And the sooner you start, the greater the results will be throughout your life.